Welcome. Thank you for joining us today at the St. Clair County EMA office for our weekly update on the COVID-19. We'll be going over our stats for the last week. I wanted to just tell you I had a guest lined up today. A victim of COVID was going to join us, but still feeling underneath the weather, her and her family. But hopefully they'll get better by next week, and hopefully she'll come on next Thursday and kind of explain just what it was that her entire family went through. So we'll keep you posted on that. I'm joined here today with Samantha Bierman from the Health Department and Chairman Mark Kern. Sam, you have the current numbers, and then we'll go over what the entire week was.
Yes, we do have a lot of numbers to go over today. So as of today, 21,446 tests have been performed in St. Clair County, with 2,412 positive test results, which is an increase of 42 from yesterday. And that does include both males and females from under the age of 10 up to their 80s. We are at 18,960 negative test results, with 74 results that are still pending. Happy to announce that we have no new additional deaths today, so we are at 144. For those who have completed the required IDPH 14-day quarantine, we are at 1,752. For state totals, we are at 1,878,756 that have been tested, with 150,450 positive test results, which is an increase of 1,018 from yesterday. And for deaths, the state is reporting 7,119, which is an increase of 20 from yesterday. For our hospitalization numbers, and these are for hospitals that are in St. Clair County, currently 23 people are admitted due to COVID-related reasons, and 3 of those patients are on ventilators. For congregate living facilities, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, and we do have a few new additions to this list. Adaptive Illinois has 2 cases and no deaths. Atrium of Belleville has 2 cases and no deaths. Autumn Meadows of Cahokia has 5 cases and no deaths. Brea of Belleville has 57 cases and 7 deaths. Brea of Cahokia has 26 cases and 3 deaths. Caritas Family Solutions in Belleville has 12 cases and no deaths. Caseyville Nursing and Rehab has 4 cases and no deaths. Cedarhurst of Shiloh has 13 cases and no deaths. Cedar Ridge of Lebanon has 73 cases and 10 deaths. The Cedars of Lebanon has 2 cases and no deaths. Colonnade Senior Living in O'Fallon has 5 cases and no deaths. The Esquilin Dammert Center at the Shrine has 2 cases and no deaths. Four Fountains in Belleville has 104 cases and 27 deaths. Help at Home in Belleville has 2 cases and no deaths. And Help at Home in O'Fallon currently has 5 cases and no deaths. Integrity Healthcare in Belleville has 3 cases and no deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center has 56 cases and 11 deaths. Memorial Care Center in Belleville has 49 cases and 5 deaths. Mercy Rehab and Care in Swansea has 3 cases and no deaths. New Athens Home for the Aged has 57 cases and 7 deaths. St. Paul's Home in Belleville has 50 cases and 14 deaths. Swansea Rehab and Care has 41 cases and 7 deaths. And finally, TDL Incorporated in Belleville has 4 cases and no deaths. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. So Sam, it appears that our hospital numbers remain fairly steady, hospitalization numbers, so that's always a key metric that we look at.
It is.
But our increase is really much greater than it should be. We are trending higher than most other areas, and certainly that's not a good thing. So
it's higher than what we would like to see, yes.
And so I think our message really that we're getting out is we've got to be vigilant. We got to wear these masks. There's an issue in St. Clair County that our numbers are higher, and so we have to be more vigilant, I believe, than other places, obviously, because our increase is continuing to be above what's normal.
It is, and we understand how hard it is. We certainly don't like wearing masks when we're out, and it's even harder now that the warm weather has come and you want to be outside enjoying the summer vacation with your family and friends. But if we are not careful and we don't continue through with what we've worked so hard on the last couple months, my fear is that it's going to be for nothing. All the hard work we've done the past couple months, and we're going to be right back to where we were. So we sympathize, and trust me, we are ready to be mask-free as well, and we will celebrate when that day comes. But right now, we still need to continue wearing our masks and to practice social distancing and good hand hygiene and all of those.
So we've tested 3,020 people since last Thursday.
Yes.
So now we're doing this once a week, and that'll be for the time being until we see the numbers start to change drastically. Then we might be back here every day. But 3,020 people tested, 245 came back positive.
Yes.
That's 8.1%, I think. Isn't that right, Brian? So that's just that's a sizable increase.
It is.
We can talk all we want about, well, you're testing more, so obviously you're going to have more positives, but it's really that percent increase that is that's fairly alarming for us.
It is. As we test more people, we do expect to see an increase in positives, but where we are at with 245, that's even a little higher than what we would expect for just increased testing.
So that's why we need to keep a hold of those numbers.
And I think it's worth letting our followers know that these are just not us crunching these numbers. Within the last 24 hours, I've had several of the news media outlets that are also watching these numbers are calling and saying, hey, are you watching this? We're seeing a climb. And I've reassured them also that, that's why we're doing this. Just because we're only here once a week, we're still crunching numbers every day. Sam is here. We're on the phone. So we're watching it very closely. But as the chairman said, it's up there and don't need.
And our numbers have consistently been higher.
Yes.
We've noticed all along. We have higher numbers. That's why we have to be more vigilant. That's why we've asked more of people. We started out early. Wash your hands. And when we were given guidance by CDC, we started the wear your mask campaign, which we continue on today.
Sure.
We encourage people, when you go out, wear those masks. So we'll move into the zip code report, and maybe that'll help clarify also where some of the numbers are coming from. So remember, what I'm going to do today, I'm going to give the daily increase, and then I'll talk about how it went from last week, just for people who have followed us and have been here last week. It may help to just clarify these increases. 62059 remains at 7. It's been that way for a while, so that zip code has been containing things pretty well. In 62201, they went up by 2 today to 136, but that's an increase of 14 over last week. So you're already above 10% in 62201 as far as an increase goes. 62203 went up by 1 today to 77. That's an increase of 7 over last week. 62204 is at 75, which is the same as it was yesterday, but an increase of 6 from last week. 62205 went up by 3 today to 91, and that's an increase of 7 over last week. 62206 is now at 213. That's an increase of 3 over yesterday and 23 over last week. So that's significantly over 10% of an increase. So it's something that we need to keep our eye on, certainly. 62207 went up by 2 today to 119. That's an increase of 5 over last week. 62208 went up by 3 to 120. That's an increase of 9 over last week. 62220 saw an increase of 6 today to 210, and that's an increase of 27 over last week. So that number is way above the 10% level, and I know that's of great concern to many. 62221 went up by 2 today to 198. That's an increase of 26 over last week. 20 and 21, kind of 62220, 62221 are kind of in a race between those two zip codes to see who's higher. Right now, 62220 is winning or losing, depending on how you want to look at that issue. 62223 went up by 1 today to 80. That's an increase of 3 over last week. 62226 went up by 6 to 242. That's an increase of 25 over last week. 62232 went up by 3 to 50. That's an increase of 10 over last week. So that's a 20% increase in that particular zip code. Something also to be aware of. 62239 remained the same at 22 and the same from last week. 62240 is a new zip code we're adding today, and they come in at 6. 62243 remains the same today at 11. That's an increase of 2 over last week. 62254 remains the same today at 101. That's an increase of 1 over last week. 62255 remains the same at 7. And the same as last week. 62257 remains the same at 13. 62258 went up by 1 today to 25, and that's an increase of 11 over last week. That was one of our mobile testing sites. 62260 remains the same at 6, or went up, remains the same today at 16, but went up by 2 over last week. 62264 went up by 2 today and 3 over last week to 59. 62269 went up by 4 today to 127, and that's an increase of 21 over last week. So that's another one of those big spikes in numbers in 62269. And 62285 went up by 1 today to 22, and that's an increase of 1. So a lot of numbers there, Herb, but I think it's apparent that the percentage increase is something that we've got to, that's worrisome to me. I think it's worrisome to you, which is why we just ask people to be vigilant. Wearing a mask is a simple thing. If both parties are wearing masks, science shows that the chance of transmission is far, far less than it would be if one or the other was wearing or neither were wearing. Certainly, you have the best chance of not getting COVID if everybody wears a mask.
Exactly, and it's we've had the medical physicians, and I like telling our viewers that follow, as you know, we have people are on there who thinks it's a hoax. Their conspiracy theories just don't carry any weight as far as I'm concerned. But when I've had physicians on here, they've come on and said, wear a mask, practice social distancing, wash your hands. Those are the physicians that we're going to be taking care of our families and loved ones when they go in the hospital. So that's who I'm going to be following and listening to. I can tell you. Some more numbers. I had a couple of people ask about the PPE distribution. We continue to supply the first responders, so I thought it was time to give you some updates on that. As recently as yesterday, we provided 41 different agencies with their PPE that they had requested. But so far, some more numbers we're going to throw out to you today. Since March 14th through yesterday, we've provided 51,580 surgical masks, 30,026 N95 masks, 3,520 sets of goggles, 370 cases of bulk hand sanitizer, 164 boxes of small gloves, 331 boxes of medium gloves, 781 boxes of large gloves, 704 boxes of extra large gloves, 28,319 isolation gowns, 424 gallons of bleach, 69 of the 5-gallon buckets of industrial disinfect, 226 no-touch thermometers, 19,594 hand sanitizer packets, 12,550 8-ounce bottles of the hand sanitizer, 6,603 face shields, 513 boxes of the 55-gallon trash bags, 217 boxes of 30-gallon trash bags, and that's just the supplies that we've gave out here. That's not counting what Sam distributes out of the health department to the long-term health care facilities and hospitals. So as you can see, we have been very proactive in trying to keep our first responders, hospitals, and all of them full of the PPE equipment, and I feel that that's going to be going on for quite some time. We talk about our numbers. The state number has been underneath 1,000 this last week. Now all of a sudden today it's 1,018. The good thing here locally, no new deaths in St. Clair County. Statewide, 20 of them. Again, I keep saying one is too many. We want to continue to do what you've all worked so hard to do. Team St. Clair has done everything the right way since day one. I don't care if you agree or disagree. For those of you who are part of Team St. Clair, doing your part, wearing your masks, practicing social distancing, washing your hands, and helping spread the word. I've had people private message us and say, what can we do to help? Well, what you do to help is continue to do what we're asking and spread that word. Share this briefing. Nobody gets anything out of this. Like I said, we went to a weekly briefing because we was watching those numbers. We don't want to have to come back and start doing daily briefings, but those numbers will dictate that to us, and the chairman will dictate that. When he says to push the button, we'll push it. So,
And when you're out there and you're wearing a mask and you're doing the right thing, you're an example for others. And setting that example and letting people know just by saying, hey, they're doing it, it's all right. I should be doing it too.
exactly. Sam wants to talk a little bit about the long-term healthcare testing. We've had some questions about that. Can you kind of go over again that process? There's people call and say, well, I've got a relation that lives in this facility and they haven't been tested. Can you kind of explain how that works?
Sure. So when IDPH came out with the guidelines for testing long-term care facilities, it was mandated and required that any facility that receives CMS funding, which is Medicare and Medicaid funding, they were required to test. So that is all of your long-term care skilled nursing facilities. The independent living facilities, they do not receive any Medicare, Medicaid funding from their residents, so they are not required to test. However, we do encourage them to test, and if they did want to test, we have had a few that have chosen to. We've helped them go down the road and navigate, how to test, when to test. But we have had some questions lately from family members that have called the health department wanting to know, how often do we test in the skilled long-term care facilities? So what will happen is we do a baseline test. So that would be we test all of the residents and or staff in the building. And if 2 or more of those individuals come back positive, like we say every time when we announce our long-term care outbreak list, 2 or more are positive, then they are classified as outbreak status. And what happens from there on out is, let's say that they have 2 positives. The following week, we would test all of the residents and or staff again, except those 2 positives. And then whatever, let's say we have 3 more that second week, so that brings us to 5 total. So the third week, we would test everyone but those 5 positive. And we just keep going down the line until we have 28 consecutive days of no positive tests. And at that point, then we say the outbreak has completed, and we move on. But that's in a nutshell how we do our long-term testing. So really, it's a 28-day span of no positive tests, which, depending on the facility, as we had talked about, Four Fountains was one of our hardest hit facilities. It took them quite a while to reach that 28-day mark because they would go maybe halfway through and then another one would pop up and then you start that clock all over again. So, but it's just a way for that facility and the state to get an accurate account of, if that virus is still in the facility.
Right. Well, that's good. I'm glad. I hope that answers some of the questions of the people who've asked. The other thing I wanted to just say, the mobile testing sites. We've got one coming up July 14th at the O'Fallon Sports Park. So you can check with the O'Fallon city leaders there. They're all on board with that. The mayor, I know, has been out promoting that. And then just today, Barb Holt from the health department and I, with the mayor of Dupo, and East Grondalet are setting up one July 21st at the Dupo Park. So we encourage any of you to take advantage of those mobile testing sites, and there will be some information being posted up on both of those that help you be reminded. Because the mobile testing, as we saw in the other areas where they've been, Marissa and Lebanon and places like that, people have been taking advantage of that. So we really appreciate that. That is going to be our wrap up for today, for this week. Again, Team St. Clair, we can't thank you enough, but don't let the foot up off the pedal, off the gas. We've got to wear the mask, wash the hands, social distancing, form your own opinion, read whatever articles you want to. But as I say all the time, and the staff here, you know, we've had the doctors in here, we've had the medical experts in here and tell us that wear the mask is our best defense. Is it 100%? No, nobody's arguing that, but it's sure better than nothing. We'll be back here next Thursday, unless it's something warrants an in-between time, for the next weekly update. And as always, if you have any questions, leave them and we'll answer them. See you next week.